least theoretically, and start the conversation, which is all that it took. The kind of secret that I always tell people when we talk about this from the EMS side is that we had to be able to convince the hospitals that this was their idea. Why was that important? Because somebody has to foot the bill. And typically EMS agencies are not the source of the finances in a project like this. And plus, the way that Pulsera is built as a communication system, it's meant to go from the field to the hospital and then all the way up the hospital service lines. And so the hospitals really have to take ownership of it. And if EMS were to come to the hospitals and say, hey, we have this project or this type of system we would like to implement, but you have to implement it on your side, typically, at least historically to me, the hospitals were less responsive to that. Now, if we could sit the hospitals down with Pulsera and say, why don't you just have a conversation with them and see if Pulsera has something that they could potentially offer you to make your system better within the hospital communication, that was the key. And once the hospitals recognized how this could help them, then it was just easy for EMS to tag on. And then if we did our job right, which I think we did here, by the time we got this thing implemented, everybody had forgotten that this was really an EMS initiative to make this happen. And that's the way that I think it worked out well for us. So I mentioned that the hospitals really have to take financial ownership. Within the hospitals, the service lines need to buy into this. And main service lines for us were the neurosciences, cardiovascular, and the emergency departments. I think that would be pretty similar in most other places. The administrations of the hospitals really had to take ownership of this, not only financially, but also as the champions of monitoring and pushing people forward. I'll talk about that in a little bit. I didn't really recognize that in the early stages of this, but it became a crucial factor. IT services, obviously IT is a huge deal, and to be able to coordinate this and to mesh the Pulsera system into hospital systems, it takes the buy-in of the hospital and EMS agency IT services. And that's something that does take time, and Pulsera has been incredible about coming out and making sure that every little rock is overturned and that they're helping to solve every issue, because we have learned that all the issues are solvable. We just have to be willing to look at them. So and with the hospitals, all of the hospitals did go online the exact same day, all 4 of them in our city. So as far as EMS agencies are concerned, they had some maneuvering they needed to do also. For the EMS agencies, the Pulsera application is free, but it always comes with some sort of cost because we had EMS agencies out here that didn't have smart devices. They used radios, and they used flip phones that were provided by their services. For instance, AMR didn't have any smart devices. And so we needed to make sure that everybody had the hardware that they were going to need in order to use Pulsera. And so that took a little bit of time. And then also, as I mentioned, we had multiple EMS agencies, 50 that feed into our 4 hospitals, but 19 of them that are the core agencies that provide most of the patient transports to these hospitals. And so we had to work out training programs to train all of these people. And as anybody who works in EMS knows, we have armies of people to train out there. And initially I was a little bit concerned about how that would go. But in the end, what happened was that this program and this technology is so simple to use and so intuitive that literally we handed it out, gave them a few-minute video on how to watch it. And even if they did or didn't watch the video, they could just open up the application and figure out how to use it by themselves, just because it functions the same way that modern life functions with any other smart application. And so it was really very, very easy to train them. Interestingly enough, the main fire districts out here had forgotten to do their training. And I didn't discover that until the day we were rolling Pulsera out as a full community. And just within that day, that agency had no problem using it because it was just so intuitive and so easy to use. We did get all 19 EMS agencies that are in the in and surrounding the city up and running on the same day with all 4 hospitals. This is just a graph that shows you, we started it in July of last year, and right out of the gates, we had a push to use this, and they were using it for STEMIs, they were using it for strokes to communicate with the hospital, and right out of the gate, the very first month, we had 88% of the STEMI alerts coming into this particular hospital, which is Penrose, Maine. They were alerted via Pulsera. St. Francis had some, not some glitches, but their reporting was not very good on this, so it had been left at 0. But in August, Penrose Hospital and St. Francis Medical Center, you can see they had a little bit of a dip as we were getting everybody on board and working out some of the technological glitches. But then by September, we had 100% across the board, and there were no STEMIs that arrived to the hospitals through EMS that were not activated through Pulsera. And this goes to show you for strokes also, the July, August, September, where there was the ramp up. But once we got into using it for a couple of months, it was the standard, and only if we were on a mountainside or couldn't call in because we didn't have any cell reception, they would use radios with the repeaters. But essentially, everybody was up and running nearly 100% just a couple of months out, and that, I believe, is absolutely phenomenal when it comes to dealing with such huge numbers. You know, literally thousands of EMS employees that are all going to have to learn how to use this. So what are the benefits that we've noticed from doing this? Well, in the emergency departments, Pulsera allows us to pre-register a patient. We get HIPAA-compliant information beamed right to the hospital through the app. And the hospital emergency department can pre-register a patient, and then they can have everything waiting for that patient instead of a delay in patient care while they register them when they hit the door, and they can't go to CT scan yet, or you can't order the labs. And you really can't start treatment very well at all without having them registered. So that pretty much just evaporated with the advent of Pulsera, which I would say was one of the largest fundamental shifts that got everybody to buy into this. You can also monitor the patient, the patient's status in the care process, and what I mean by that is that as Pulsera communication goes up the service lines from EMS to the emergency department and then up to the neuro lab or the cath lab, you can actually see the information about the patient through the application as these different units within the service line are feeding in the information about the patient care. And so it's really real-time patient information, which is fantastic, especially for EMS, because before they were not able to really get any information about these patients until much later, usually. You can monitor arrival time. This was something that we never expected. We weren't looking out for. We were not anticipating that we would even use this. But one of the things that inherently Pulsera does is that it tags the EMS agency where they are on GPS and gives an accurate ETA. So what we did was we lost that universal will arrive in 5 minutes patch, and we really knew how long people were going to take to get into the hospital. And why does this matter? Well, it may not matter as much for EMS, But for the hospitals, it really matters, because if you are calling an alert on somebody, that usually means that resources going to other patients have stopped, so that we can wait and spend these resources on patients that are arriving, meaning a CT scan will be cleared. No patients that are in the emergency department will be going to that particular CT scan because they're waiting for this EMS crew to arrive with a stroke alert. And that you could imagine that if we knew that they were 20 minutes out, and we could really get that accurately documented, even though the crew gives the 5 minutes out, we know they're 20 minutes out, and we know that we can get another patient into the CT scanner, but we can still have it clear when the patient arrives. And you could extrapolate on that with laboratory services and everything else, how you move beds around in the emergency department and staff. And it also allows the facilities to bypass the cath lab or get to the CT scan faster. And I'll talk a little bit about that here specifically. So, for instance, with the neurosciences, with Pulsera, we'll be able to see the patient in the field. And we're still working on some of that application, but ultimately that will be a huge benefit for a end user. And I refer to like the interventional radiologists or the neurosurgeons, the people who are actually be performing the definitive care on these patients. When they are attached to the Pulsera system, they can then communicate directly through the application to all the way down and out back into the field, and that is invaluable to have that type of direct communication. It also improves the efficiency of the personnel, like I talked about, that they can they really know when they're going to need to use certain personnel within the hospital based on information that can be sent over by Pulsera that normally can't be sent over by traditional communications. It improves the patient flow because we can pre-register them, we can get them into CT scan faster, and it really does decrease the time we notice in our system to get a CT scan or get the patient to intervention. I have loads and loads of slides that show numbers and the stats of how our hospitals have improved with that, but I just have a couple I'll throw up here. And this was from last year, where we had from January all the way to September, when we actually implemented the Pulsera for this one service line and started documenting this about patients getting the CT scan. You can see that in general, what happened was that the time from that the patients spent to get to CT scan were much less after we implemented Pulsera, and this has really gone down and plateaued out much lower than it has traditionally. And so it really does save time. It really does give patients better treatment.